All right, thank you all for being here. This is UAMS's first virtual Walk with a Doc and Walk with a Future Doc. Super excited. This is also our anniversary year. So we've done 1 year of Walk with a Doc and Walk with a Future Doc talks. So super exciting. But because of the pandemic, we all can't walk together. So we wanted to find a cool way to celebrate and also kind of encourage everyone to get out there and walk. And so I have a panel of experts and Walk with a Doc and Walk with a Future Doc featured docs and future docs who have talked throughout the year. And so we're going to ask them a couple of questions about walking, about the pandemic, some of the things that you guys may have questions about, and then we all are going to do a walk. Let's start with Dr. Menderata. Hi, Dr. Menderata. If you don't mind telling us a little bit about yourself, and then I know lots of people have questions, especially with your population that tends to be high risk for this pandemic. What is safe? Can they walk? What sort of things should they be doing if they decide that they need to walk?
Hi, I'm Priya Mendirata, and I'm a geriatric faculty and also the clerkship and course director for geriatrics. So I work a lot with the student population as well as with our older adults. And one of the things, definitely at this time, we are encouraging all of our older adults to go out and exercise, especially if they cannot get out of their house. They can get into their backyards. They can do some yard work, they can take a walk, they can go at times when it is much safer, whether it's early in the morning or maybe a little bit late in the daytime, taking a flashlight maybe with them on trails where they don't see very many people around, and that's very safe. So that also decreases the amount of stress they are going through. It keeps them more fit, it gives them a routine, and helps with preventing some of the diseases, as you know, like whether it's hypertension, diabetes, or their underlying heart disease. All of these get better controlled if they exercise. And many of our patients are already doing that when I'm doing the televisits with them. They all describe that definitely they've been trying to keep fit. Some of them have actually lost more weight because the spouses are watching out for each other. They're cooking at home and they're eating more healthy. But some of those who are not doing that already should definitely include all these routines, in their daily life right now. And one of the questions I often get asked, how do I get out safely? Well, if you touch any surface, clean your hands well, and hand washing is the most important cornerstone for prevention. Mask, use a mask in crowded places. Definitely keep it with you. If you think you are going to run into too many people on the trail, you may want to use it for part of the area where there are too many people around you. But always maintain that social distancing, 6 feet apart. That's very important. And many of them are using senior hours to go and do their groceries and things like that. But even for exercise, it's important that they follow some of these rules that are important. And again, culture change. There's a culture around all these things, right? Whether it's hand washing or keeping social distance or masking, and all the other people should understand that our older adults are very much at risk for infections, because we know that COVID-19 is affecting elderly. And as you know, that out of the total mortality, right now, 30%, 30,000 or even more than that has been in our very frail older adults who are in the nursing home. But that's my message to all the people out there who are trying to stay safe. Thank you.
Thank you. That's a great message. I think we're going to move on to Dr. Howard. He was one of the early supporters for the Future Docs and a speaker again for UAMS, one of our walks. If you don't mind telling us a little bit about yourself and what sort of tips you would give our walkers. I know a lot of my patients have been pretty sedentary. They're complaining about back pain, neck pain. I even had somebody who complained about tailbone pain from sitting for too long. What sort of things would you tell people? Can they get out and walk when they're sore, when they're having these back issues, neck issues? what sort of things do you tell your patients in terms of getting out there?
Sure. Good morning, everyone. I'm Dr. Howard. I'm a physical medicine and rehab physician at UAMS with a subspecialty in sports medicine. So I'm by profession and by personal interest, just the guy who kind of gets people out there and get them going. I want to say that since things started with the social distancing and quarantining, I've been very encouraged to see, at least in my neighborhood, a lot of people out walking, running, and taking advantage of things like walking the dog, just as an excuse to get out there. And I want to encourage that to our listeners and to our viewers as well, our participants through the year. Some general advice would be to start slow. There's a kind of a mental barrier that we kind of have to cross where we think that we have to get out there and immediately start doing miles. And your walk for the day may just be around the block or up the street and back. And in some of my patients' cases, especially those who are struggling with joint pains, it's walking to the mailbox and back. And so there's no shame, there's no reason why your walk can't be something as simple as walking to the mailbox. So start slow and then gradually increase your activity. So set a goal. So this week I'm going to walk to the mailbox and back. Next week I'm going to do it twice. Start slow and go slower. Two of the main bits of advice that I give people to try and avoid aggravating whatever existing musculoskeletal issues they already have, or developing new ones because there's been too sudden of an increase in their physical activity. And then one thing is things heat up. We just, I guess, officially started summer a couple of days ago. Stay hydrated and pay attention to taking water or one of the electrolyte drinks along with you, anything that can help you stay hydrated while you walk. Even in the early morning now in Arkansas, it's going to be on the warmer side and only getting more warm. Warmer still as the months continue. So stay hydrated as you walk, but get out there, go slow, and just do what you can.
I think that's great advice. Thank you, Dr. Howard. I want to move on to our future docs. We've got Kristen and Anusha. You guys can talk individually, but introduce yourself. I know that life has kind of been different for you in that med students kind of have had a different world with this pandemic, kind of being pulled out of your normal routine, going virtually. So I would like to know, what sort of things have you guys been doing to cope? Are you getting out there? What things are you doing to stay healthy? What advice would you have for other students who are sitting at home, learning virtually? And any advice or thoughts and comments you guys might have? We can start with Kristen and then we'll go to Anusha.
Yeah, so I guess I'm a third year student still. This whole thing happening, things have been put on delay a little bit. But I'm president of the Future Docs, soon to lose my title to Anusha whenever things go back to normal. I think the first 2 years of school were kind of similar to what's been going on, so I'm okay with being at home and having to study on my own. So that's been relatively easy. I think the hard part has been not knowing, I guess, what's going to happen, having that uncertainty about how I'm going to move forward and learn to be the best doctor I can. But, you know, because that's out of my control, the only thing I can do is focus on what's right in front of me. So I've been running outside a lot. I've been going on walks, just trying to keep my mind occupied. And whenever it's too hot or I'm too tired, I stay inside, and I've kind of picked up some new hobbies. So I've been cooking a lot more and trying things. I got a drill and like some tools. I've been putting things together. I put together a headboard. So just anything that will keep me going.
Thanks, Kristen. What about you, Anusha?
So I'm currently studying for my first board exam, and honestly, I probably would be doing the same thing now if there was or was not a pandemic. So I am inside, putting in some hours, but it is weird because we have to take our exams with masks now. So that was not something I was expecting to have to practice for, in addition to learning everything for step one. But I've been taking breaks. I'm quarantining here with my parents. So we all eat together for lunch and dinner. We go for walks together and we cook together. And in between, for study breaks, I FaceTime with friends. And like Christian mentioned, it's just there's a lot of uncertainty, but we just have to stay positive and adapt because we don't know what's going to happen, but we can control what's in front of us right now.
Thank you. I think that's a great segue to talking to Dr. Thapa. Thank you for being here and being our recorder. I know a lot of people, I've been working COVID triage, the drive-through triage screening. So I see a lot of people that have anxiety, depressions about the uncertainty of COVID, when we're going to go back to a normal life. What are you seeing and what sort of tips are you giving people in terms of maintaining their wellness, their physical life, and the mental life? If you want to first introduce yourself a little bit and then tell us what you've been telling your patients.
Sure. Thank you very much, Alexa. So my name is Puru Thapa, and I'm a faculty in psychiatry, but I'm also the director of student wellness, resident wellness, and faculty wellness. And you're absolutely right. In these very uncertain times, there is a much higher level of stress, anxiety, some depression. But, Christian and Anusha captured this, stole away my thunder, what I was about to say. Basically, what we need to keep in mind is that these are unprecedented times. There is an extreme amount of uncertainty. We like to have a sense of control. We like to feel that we know what's going to happen tomorrow, day after, and so on. The reality is we really don't. So what we have to keep in mind is that our brain, our mind is programmed evolutionary, right? The survival circuitry, if you will, where we are prepared for the worst kind of a scenario. We had to do that in the prehistoric days, otherwise the saber-toothed tiger would eat us, right? We couldn't say, nothing's going to happen. So the threat for us is this whole uncertainty, right? And that's the threat. And in our mind, we react to that, obviously, right? And our stress level goes up, our, fight, flight, or freeze, system kicks in. Now, the first thing that I want to emphasize is that this is normal, okay? And in times of crisis like this, we end up, our level even goes up. Our mind gets preoccupied with this kind of thing. What if only, like for Anusha, with all the changes going on, and I think things are a little better now, but about a month ago, everything was in chaos in terms of when the test would be, exams would be where, and when they could do it. And so it just generates a lot of stress. And the way our mind reacts, it's going to react this way. However, if you get too preoccupied about things that we can't control, while it is normal to be expected, it's not very helpful. So my message, to our student, and I've been seeing faculty as well, is, focus on what you can control. Don't focus on what you cannot. And what do I mean by that? You can control your action and behavior, right? You have much more control over that than trying to control or shut your mind down. So when Christian said, I'm walking, I'm jogging, and this is a perfect example of we control our behavior. So instead of staying there and sitting in our mind, right, which is not very helpful, and we can't really control the uncertainty, what's going to happen tomorrow. But if we bring our energy and focus on things that we can control, which is our action and behavior. So, Anusha is going out for walks with her parents together, right? Being safe. Christian is, going out for a jog. or he's out there fixing headboards or doing other stuff. So those things we control. And so what happens is when we come into our body, right, being in the present, things that you can control, what you find is that your mind is not as occupied. And when you're doing that, the key point is to remember to acknowledge, man, this is uncertain. Yes, this is stressful, right? Because many times people will just want to wash it away and say, nah, 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 I'm fine, and it doesn't bother me. It bothers all of us. And so to acknowledge that I am feeling stressed out, this is kind of scary, but you know what? This is what it is. And come back to your body, focus on what you can control. And I think that's the crucial thing, to try to do that. Now, those of you who know me, I could keep talking for the next 2-3 hours, but I think that's my main message right now. And again, what Christian and Anusa just described, what they're doing is an excellent example. Acknowledge your stress, right? Your feelings, what's happening, but then focus on things you can control, our action and our behavior. Okay? I think I'll end there.
Thank you. I think we all really appreciate that advice. I'm going to move on to Dr. Stone. I'm a family medicine resident, and Dr. Stone is a family doc as well. I know I'm seeing many more of my patients. I mean, we're doing telemedicine visits now getting back to face-to-face visits. A lot of them are struggling at home. They're overeating. They're worried about their hypertension, their diabetes. How are you encouraging your patients to get back on track, and what sort of concerns have you been seeing? I know some of my patients are concerned about the risk. How do I go back to work? Can I go back to work? Is it safe? How long should I stay at home? What sort of advice have you been giving your patients?
Well, thanks, Alexa. I have been, advising my patients much of the same things that we've discussed, and that they'll hear from figures on television, that the important things to do in going out in public and going to work are things like good hand washing and keeping your hands away from your face, social distancing, wearing a mask to prevent spread. Those simple habits can make a tremendous difference in our risk of spreading and contracting this virus. Many of the patients that I see are affected by chronic diseases like diabetes and high blood pressure and depression, and particularly with diabetes and high blood pressure, those are a group of people that are at an increased risk of getting really sick with this virus should they get it, ending up in the hospital, ending up in the ICU or worse. And, we want to really do everything we can to reduce the risk for those patients. Those folks, if you have a chronic disease like diabetes or high blood pressure, one of the biggest things that we tried to avoid is the complications of that disease. And some of the most serious ones are things like heart attacks and strokes. So we manage our blood sugar, we manage our blood pressure, but one of the biggest, most simple things that one can do to offset that risk of heart attack and stroke is to get out and exercise, to go for a walk. I think Dr. Thapa would also agree that when we're dealing with chronic problems such as depression, anxiety, one of the best antidepressants that we have is exercise.
Absolutely.
Yeah. So even though our day-to-day lives have changed dramatically, it's still important to stay moving, and it's still something that we can do safely. So that's kind of in a nutshell what I've been counseling my patients to do in this time.
I just wanted to also mention that there are a lot of UMS resources for our patients. As you know, that there are people working in physical therapy where, and I think Dr. Thapa is also part of that group, where they're offering these meditation sessions online through Zoom. There are exercises that are available through Zoom, and they're doing Tai Chi or like I think Zumba and some other things that are being regularly offered to our patients. And I also want to say to everyone, don't worry, be happy. We will come out of this stronger together. So.
Thank you, Natalie. Thank you, Dr. Menderada. So this has been great. Thank you all. I appreciate your words, your tips, your wisdom, your experiences. Again, I'm Alexa Martin. Like I said, I'm one of the co-founders of Walk with a Doc, along with Natalie and Kristen and Anusha. We want to encourage everyone to get out there. We will continue to do some of these virtual walks. You can get out with your family. You can get out and walk solo. Just make sure you bring your mask and social distance and stay positive. Thank you.
Thanks, guys.
Thank you very much, guys. Take care and start walking now.
Are we going to walk on the Zoom or we just...
Hey, you want to see me float on water?
Oh my, you're really floating, you're flying.
All right, bye guys.
Bye.
Good seeing everyone. Take care, guys.